Hi, I'm Dr. Musa Shamonki, a fertility specialist at Fertility and Surgical Associates of California, one of the clinics that has partnered with the GLOW Fertility Program. Prior to joining Fertility and Surgical Associates, I was the IVF director at UCLA for about 8 years. Prior to joining UCLA, I spent a year at Reproductive Medicine Associates of New Jersey, a high-volume private practice on the East Coast, for approximately a year. I did my medical school and residency at the University of Vermont, and I went to fellowship at Cornell in New York City. Thank you all for participating with your questions in today's question and answer session. We got well over 200 questions. That's a lot of questions to answer in an hour, so we won't be able to get to all of them, but we'll pick the ones that are most relevant and answer those and applicable to some of the others that may have been asked that may be linked in some way. So one of the most common questions that we get is, how long is long enough? How long have I been trying where I can say, okay, I've tried long enough where this is now considered not normal? And basically the answer is overall about a year of trying without success. However, there are other reasons to seek help perhaps prior to waiting for a full year. So for example, if a woman doesn't have regular predictable periods, she should probably seek help earlier because that may indicate that she's not ovulating predictably. Or if she's had prior abdominal surgery or a previous pelvic infection, those can also be indications to seek help earlier than waiting for a year. And another really common reason to seek help earlier is if a woman is 35 years or older, because the majority of a woman's eggs are not normal as they get older and approach their late 30s and early 40s. And for those many reasons that I just mentioned, it may be appropriate to actually seek help prior to waiting for a full year of trying. One of the really common questions that our users have asked is, if I'm having irregular periods, am I ovulating? And let me answer it the opposite way. If you are having regular periods, you're ovulating 97% of the time. There was a large study that demonstrated that. However, if you're not having regular periods, and let's say you're skipping a month, that means you did not ovulate that whole month before. And basically you get a period 2 weeks after you ovulate, assuming you're not pregnant. And so generally speaking, if you're not having predictable cycles, you're probably not predictably ovulating. There are medicines that can help you to ovulate, but those medicines must be administered under the supervision of a physician, specifically either your OBGYN or a subspecialist like your fertility specialist. Those medicines can include oral medicines such as Clomid or Letrozole, or injectable medicines such as injectable FSH or another medicine called HMG. Your doctor will specify the type of medicine that's most appropriate for you and will instruct you on how to administer it. So a common question is, when is it most appropriate to go in and speak to my doctor about my chances of pregnancy? This is a very broad and general question, but I'll answer it generally. When a woman is in her 20s, she's very likely highly fertile. And if she's thinking about pregnancy in the coming few months to few years, she's likely safe to wait. However, as a woman enters her 30s, especially if she's not willing or planning to conceive relatively soon, it may be a good idea to go see your doctor so that they do a fertility evaluation. Fertility evaluation involves taking a full history, doing an examination, doing some blood work, and doing an ultrasound to look for egg numbers in the ovaries. Some women and couples want to know if there's a sure way of knowing if one is ovulating. And really, the only sure way is if you're having predictable menstrual cycles. The other near sure way is to do an ovulation prediction kit. And that can demonstrate a peak, which suggests that you'll be ovulating that very next day. And you'll know if it actually was accurate because you'll either be pregnant or have a period about 2 weeks after that point. And those are probably the two best ways of knowing. You could go see your doctor, and if you determine exactly when you've ovulated by an ovulation predictor kit, then approximately a week later you should have a high progesterone level. So your doctor may want to check that. Another common question is, how long do I have to wait once I have an IUD removed before I can get pregnant? And the reality is you can start right away. your body should recover within the next cycle after the IUD is removed and go back to whatever baseline you were at. And so once the IUD is removed, once you get a period, you should be right back to your baseline, whatever that baseline is. Biochemical pregnancies are an outcome where you get a positive pregnancy test, but unfortunately that pregnancy never develops. The pregnancy hormone goes up and then it goes right back down, and then one gets their period. Virtually all of these pregnancies occurred because a genetically abnormal embryo stuck temporarily, grew a little bit, but nature's way of dealing with these things are that the pregnancy will stop developing and will go away. Nature is a great filter. Most abnormal embryos never even stick. The vast majority of abnormal embryos that do stick will miscarry, or you'll get this biochemical pregnancy. Very few of the abnormal embryos continue to develop into genetically abnormal fetuses and babies. We have ways of detecting those later in the pregnancy, but thankfully, nature is a very good filter. So another common question is, how often should I be having sex when I'm trying to conceive? And this is a very individualized answer. There are some couples that have a very active sex life and have sex regularly. It is not too harmful, it's not harmful in fact, to have sex daily. That's a very common question we ask. In other words, is daily sex potentially harmful, and is having sex every other day less harmful or more beneficial? The answer is no. However, the reason why people say when you're around the time of ovulation, have sex every other day, isn't because sex every other day is better than every day, but rather sperm lives in the female genital tract a minimum of 2 days, but anywhere from 2 to 5 days. And so if you're having sex every other day around the time of ovulation and the days before and after your predicted ovulation date, you'll know that sperm is going to be around if and when you ovulate. An interesting question that a user asked is, can diabetes affect sperm? And I'll answer it even more broadly. Any chronic medical condition can affect sperm, ovulation, or your ability to conceive. And so generally speaking, if you have an illness, ideally you want that treated or controlled in order to maximize your fertility potential. A common question that many users ask is, if I've been on a various kind of birth control, does that affect my future fertility? Thankfully, the answer is, generally speaking, no. For example, if someone's been on birth control pills and they come off the birth control pills, are they going to have trouble conceiving? For the vast majority of women, the answer is no. Most of the time, once you're off the birth control pills, you'll have a cycle approximately anywhere from 4 to 6 weeks later. And whatever pattern of ovulation that you had, if it was monthly, that you had before, you should resume that. If you had irregular cycles prior to birth control pills, you may have irregular cycles after the birth control pills. Now, there are a small subset of women that may take a little bit longer than that 4 to 6 weeks to fully recover. And in general, that makes up a very small percentage. And over time, they will finally recover their normal ovulation. There are other kinds of birth control, such as the NuvaRing, the patch, an IUD. Those also should not have any long-term deleterious effects on your ability to conceive. There's also hormone implants that can act as birth control as well, but once those are removed, or injectable, such as Depo-Provera injectable birth control, but given enough time after that last injection or after a removal of that long-term implant, one should resume their normal ovulation, whatever that was, and be able to conceive. One of our users asked the question, other than the obvious drugs, alcohol, cigarette smoking, is there anything else I should avoid during the IVF process? Generally speaking, I say be yourself. Now, as you take these medicines to grow the eggs in your ovaries will become very large, and we generally say you want to reduce physical activity so as to avoid the ovaries from twisting on their own blood supply. Avoid any rigorous activity of any kind for that matter, just to minimize that risk. But short of those things, you can pretty much eat whatever you eat, you can pretty much drink whatever you drink in moderation, and be yourself. Sure. One question that many of our users have asked is there anything I can do to enhance my fertility? Generally speaking, the answer is be as healthy as you can. So eat well, eat a healthy, balanced diet, mostly of fruits and vegetables and lean meats, and avoid sugars, a lot of carbohydrates, and a lot of fats. Exercise regularly. And when we mean exercise regularly, at least 3 to 5 days a week of 30 to 60 minutes a day of intense exercise. And generally have sex. So it's important, if you want to get pregnant, to have sex regularly as well. Couples want to know, is there a simple solution or of any kind to infertility, or is IVF always the answer? And any good practice and any good doctor will evaluate you fully, because sometimes the right answer is do absolutely nothing. I've had couples come in having tried only 2 months and worried about their fertility. But based on my evaluation and based on their history, I may suggest trying just a little bit longer, and the vast majority of those couples will conceive naturally. Sometimes the treatment is simply helping someone to ovulate predictably, and they will otherwise get pregnant. And sometimes more aggressive treatment is needed, like IVF. It's important that we tailor our treatment to your specific story. Everyone has a different story and a different journey. Some people may require far less intervention. Some may require a lot of intervention. Everyone's different and unique. Thank you for participating in the Glow live stream fertility Q&A. I hope this question and answer session has helped you make important choices with your future fertility care.